Good evening, sir. Good evening, class. The natural history of disease refers to the progression of a disease process in an individual over time in the absence of intervention, that is, without treatment or prevention. It describes the stages through which a disease develops, from the initial exposure to the causative agent, through the pathological changes, clinical manifestation, and finally, recovery, disability, or death. It helps epidemiologists and public health officials understand when and how to intervene and the best points for screening and control measures. Stages of the natural history of the disease is 4 stages. The susceptibility stage, that before exposure, host is at risk. The subclinical disease, after the exposure but before symptoms, pathological changes begin. And the clinical disease, signs and symptoms appear, diagnosis possible, and the stage of recovery, disability, or death. That's the final outcome. The natural history of leptospirosis is a zoonotic bacterial infection caused by Leptospirea integrans and related species. It is transmitted through contact with water, soil, or food contaminated with the urine of infected animals, especially rodents. The susceptibility stage, individuals at risk are the farmers, sweet workers, veterans, people in flood-prone areas are exposed to contaminated water. Exposure occurs via skin abrasions or mucous membranes in contact with contaminated water or soil. The subclinical disease, that is the incubation period, typically 7 to 12 days, the bacteria enter the bloodstream and multiply. The person is asymptomatic during this period. The clinical disease, leptospirosis, often has a biphasic phase. A symptomatic phase, duration 4 to 7 days, symptoms sudden fever, chills, headache, conjunctival suffusion. It presents itself in the bloodstream and CSF. This may result in progress to the immune phase. And it have the immune phase, duration may follow 1 to 3 days of apparent recovery. Antibodies appear, organism localized in organs, especially the kidneys. Symptoms, meningeal irritation, jaundice, renal dysfunction, hemorrhaging or myocarditis. The recovery stage or disability or death. Mild cases, complete recovery within weeks. Severe cases may result in renal failure, hepatic dysfunction, or death. Chronic carriers, rarely leptospirosis persists in the renal tubes and in the individual may shed organism in urine for months. Thank you.